What brain regions determine your seizure type? Imagine your brain as a busy city with different neighborhoods controlling various functions. When electrical signals go haywire in one of these neighborhoods, it can cause a seizure. The specific area where this abnormal activity starts is called the seizure focus, and it largely determines what kind of seizure a person experiences. Focal seizures begin in a specific part of one brain hemisphere. If the seizure starts in the temporal lobe, which handles emotions, memory, and language, the person might experience a warning sign called an aura. This could be a sudden feeling of fear, a strange taste or smell, or a sense of familiarity called déjà vu. During the seizure, they might stare blankly or perform repetitive actions like lip smacking. If the seizure starts in the frontal lobe, responsible for movement and speech, it might cause sudden head or eye movements, vocal sounds like shouting or laughing, or repetitive motions such as rocking or bicycling. Seizures originating in the parietal lobe, which processes sensory information and body awareness, are less common but can cause unusual sensations or difficulty understanding where parts of the body are. When the occipital lobe, which manages vision, is involved, seizures can lead to visual hallucinations, temporary loss of sight, or rapid eye movements like blinking or rolling. On the other hand, generalized seizures involve abnormal electrical activity in both sides of the brain at the same time. These do not start from a single focus but affect the entire brain. For example, absence seizures cause brief lapses in awareness, where a person might stare and blink but not have convulsions. Myoclonic seizures produce sudden muscle jerks on both sides of the body, often happening in quick bursts. Tonic-clonic seizures, sometimes called grand mal seizures, involve a phase where the body stiffens, followed by rhythmic jerking movements. These seizures often cause loss of consciousness and can last a few minutes. Seizures are also classified based on how much of the brain is involved and whether consciousness is affected. Focal seizures may or may not impair awareness, and sometimes they spread to both sides of the brain, turning into bilateral tonic-clonic seizures. The structures deep inside the brain, like the hippocampus and amygdala, are also important because they help control memory and emotions. Changes or abnormalities in these areas can influence how seizures start and what type they are. Understanding exactly where in the brain a seizure begins helps doctors figure out the best way to diagnose and treat epilepsy. It also helps predict what symptoms might appear during a seizure. Remember, each person's brain is unique, so seizure types and experiences can vary widely. Always consult a healthcare professional for personalized advice and management. Knowing which brain regions are involved gives us a clearer picture of seizures and how to better support those affected by epilepsy.